What's up, everyone? Welcome to this edition of CBD Journal Club presented by CBD Health Collection, the brand of CBD that we prefer and actually me and Brittany use at home. And if it's something you're interested in, check the comments down below. There will be a link. But let's dive into this article. It's a really interesting article, very timely, especially for me as a healthcare professional. The title of the article is Efficacy and Safety of CBD plus Standard Care versus Standard Care alone for the treatment of emotional exhaustion and burnout among frontline healthcare workers during the COVID-19 pandemic. Extremely important. This is something that I've seen personally as I was dealing with COVID patients and taking care of COVID patients in the hospital and my colleagues. And burnout is real. One report estimated that it was in the mid 60s of physicians and ICU doctors, 60% physicians, ICU doctors, and nurses were burnt out. And what this study looked at was using CBD as a vehicle to help with the burnout. So let's dive into the study. In the introduction, we know the pandemic has increased emotional distress, depression, anxiety, PTSD, and insomnia, especially among healthcare workers. CBD has been shown to have anxiolytic, anti-anxiety effects in healthy volunteers and social anxiety disorder. Now, the doses used in these studies were much higher than the conventional doses that you see. They were about 300 to 600 milligram daily dosage, which is not a dose that I recommend anyone starts on their own. If you're taking that much CBD or want to take that much CBD, get with a healthcare professional who is well versed in CBD. Now, we know it also has antidepressant, anti-inflammatory effects in preclinical studies. Now, this study wanted to look at the safety and efficacy of daily CBD to decrease symptoms of emotional exhaustion and burnout. And secondarily, they also wanted to look at anxiety, depression, and PTSD through a couple of well-validated clinical resources. What they did was they compared 300 milligrams of CBD daily, it was 150 milligrams twice a day, to standard care for 28 days. Now, initially in this study, now we're moving into the methods, the evaluators wanted it to be blinded and randomized controlled. But the ethics committee said that that probably wasn't a good idea, given that these people are working with COVID-19 patients. So it was decided it was best to do an open label design where the evaluators were blind, but the people knew they were taking CBD. Exclusion criteria, they excluded people using medications that interact with CBD, history of any allergies or adverse effects to CBD, high-risk COVID groups, so people with diabetes, hypertension, lung disease, blood disease, CKD, immunosuppression, or pregnancy. The dose was 150 milligrams twice daily and MCT oil for 4 weeks. And then the standard care had motivational videos on low-impact exercise, weekly consults with psychiatrists who offered support, and then hospital executives also made sure they had adequate PPE, modifications to work schedules, and tried to do as much as they could to help these people. They were assessed remotely with survey scales, these well-validated survey scales that I talked about earlier. They used a CBD adverse effects scale to monitor for side effects for CBD. Psychiatrists also use ICD-11 criteria for burnout syndrome. This involves questionnaires looking at low energy, exhaustion, job negativity, and reduced effectiveness. They also used the burnout inventory, which is a questionnaire based upon burnout, the GAD-7, which is a questionnaire for anxiety, PHQ-9, which is for depression, and PCL-5, which is for PTSD. They collected blood samples every week to look at TNF-alpha, which is a cytokine, an inflammatory cytokine, interleukin-1B, and CBD levels, and then just some general blood measurements. The CBD was 99.6% pure. It doesn't really go into what that means. I'm assuming here that it was a 99.6% CBD isolate. 120 patients were randomized, 61 in treatment, 59 in control. During follow-up, 2 people discontinued CBD due to adverse events, but they fully recovered after CBD stopped. Most participants were nurses in the ICU, a high-risk population for burnout, and adverse effects due to COVID-19. What did they find? Those who had the CBD had a reduction in the MBI-HSS, which is that burnout validator, that burnout survey. Also, burnout syndrome based on ICD-11 decrease in the treatment group, but that wasn't statistically significant. They also found that the GAD-7 scores decreased, the PHQ-9 scores decreased, but the PCL-5 scores were unchanged. And I'll explain what that means here in a minute. They didn't find any difference in the interleukin-1B between groups, but they also found that there was no difference in TNF-alpha. And this means that they didn't see a reduction in the inflammatory cytokines in this study, but it was only a 4-week study. That could be why they didn't see that. There was no effect of plasma CBD levels on the scores on those tests. For safety, adverse effects were in line with what we've seen with other clinical trials: fatigue, diarrhea, weight gain, lethargy. Interesting enough, there was increased appetite, and the only significant difference between the two groups was in increased appetite. And this possibly could be because it was 99.6% pure, and there could be THC in there. So if it is 0.4% THC, that's 12 milligrams per dose, which is a significant dose. That might be enough to stimulate appetite. There were 5 serious adverse events. 4 had increased liver enzymes greater than 3 times the upper limit of normal. These all resolved after the CBD was stopped, and 2 people had a rash that resolved after the CBD was stopped. There was a slight increase in total cholesterol by about 8 and LDL by about 7. This was not significant statistically, and this was probably because of the MCT oil that they were using for the CBD vector. Now, in the discussion, basically what did the study find? Adding CBD to standard care reduced emotional exhaustion, anxiety, and depression scores in healthcare workers. Also decreased the number who could be diagnosed with burnout syndrome, who could be diagnosed with anxiety, could be diagnosed with depression. This is great news because it's very real. I had to step out of the hospital because it's been a nightmare, and I can't imagine what my colleagues who are still fighting this virus are going through. It's been years, and it doesn't seem like it's going to end. Here in Texas, things are pretty bad at the hospital levels right now, and anything that we can do to help the frontline healthcare workers, I hate that term, but that's the term that everybody uses, is something that is very meaningful to me. And I'm a huge believer in CBD. I've been taking CBD for years now. CBD wasn't found to decrease inflammation in the study. Burnout syndrome is associated with higher inflammatory cytokine levels. This is why we always talk about on the podcast that physical stress causes stress manifestations in the body, hormone changes, and can lead to changes like increased inflammation, increased blood sugars, things associated with chronic disease. It would be interesting if they did a longer study to see if there was any differences, or if people had high levels to begin with, they were just measuring this. They weren't looking specifically for inflammation. The limitations: it was a single center study. It was in Brazil. So generalizing that to the general public, there could be differences there. There was no cognitive testing done, which would have been interesting to see if it improved ability to function and work. And of course, it wasn't a randomized controlled trial where the people were blinded to the interventions, but the authors hypothesized that the effect wasn't just due to placebo effect, because it's in line with the effects that we've seen with other studies with CBD. All right, well, we'll continue to bring you more studies as they come related to CBD that we find interesting. It is a hot area of study right now, so we'll keep it going on this channel. Thank you guys for listening, and have a blessed day.